Hello there. Today we will be talking about an important topic, and that is the acute drop in hemoglobin in sickle cell disease. So they usually give in a vignette that the patient has sickle cell disease and now presents with features of acute severe anemia. Their hemoglobin has dropped to 3 or 4, and the patient has features of asthma, of anemia, like pallor, like fatigue. So whenever they give you a scenario like that, acute severe anemia in a patient with sickle cell disease, you should be really thinking about two things. One is the aplastic crisis, and the second is the splenic sequestration crisis. So let's first talk about the aplastic crisis. So what is involved here is the bone marrow. I want you to think about the bone marrow. And in the bone marrow, we have a erythroid progenitor cells. Erythroid progenitor cells. So the aplastic crisis happen when you have something called the parvovirus B19. Parvovirus B19. It binds to the P antigen, of the erythroid precursor cells, and that basically just stops erythropoiesis. So the hemoglobin, the red cells, they do not form. So it halts erythropoiesis by using the P antigen. So patients who lack the P antigen will be immune to parvovirus B19. Those who have the P antigens, the parvovirus B19 will actually halt the erythroid progenitor erythropoiesis by inhibiting the erythroid progenitor cells using the P antigen. So now, whenever you have, so this will result in obviously decreased hemoglobin because there is no erythropoiesis. So now I want you to think about that whenever there is a drop in hemoglobin, what is the response of the marrow? The response of the marrow is that it should cause increased erythropoiesis, right? And that erythropoiesis, how would you know that the bone is actually producing new red cells? You will know this by the radic count. But in aplastic crisis, the bone itself is damaged. The erythroid precursors are themselves damaged. So do you think that there will be increased radic count? Obviously, there will be drop in radic count because these erythroid progenitors lead to increased radic count. But the erythroid progenitors are not even working here. So radic count decreased. Then come to the splenic sequestration crisis. So here, the bone was involved, right, in the aplastic crisis. Here, the spleen, as the name suggests, it's the spleen that is involved. So let's say if this is our hypothetical spleen. So normally what happens is that normal cells, there are really tight vessels, narrow vessels in the spleen, and the normal cells that are like this and deformable, they can just maneuver through them by changing their shape. But the sickle cells, during a sickle attack, the sickle cells are really big, so they cannot actually fit in those tight vessels. They cannot maneuver, they cannot bend to go through that. So that a lot of the red cells would kind of accumulate in the spleen. And the spleen has a really large capacity to hold on to a lot of red cells, and so they will hold on to red cells, although the platelets and red cells are really held on to here. So in the normal circulation, we will have really decreased red cells because all of them are just stuck here. They cannot go through the tight vessels. So RBCs in the general circulation will be low. The reticulocyte, the platelets will also be low. The platelets, because both of them are just kind of stuck in this big spleen. So then let me tell you, so like we talked about, like whenever there is decreased red blood cells, decreased HB, what is the marrow response? It should produce baby red cells. Those baby red cells are reticulocytes. And so here we will have increased radic count. Because here, the bone marrow here is normal. This bone marrow is normal. So it will produce increased red cells, and those and that increased synthesis actually will on the picture, you would know that there is increased synthesis by the bone marrow by looking at the retic count. So the retic count will be more. And remember, here there is decreased HB, there is decreased hemoglobin, plus there is also decreased platelets, because the spleen is kind of holding on to those platelets. So hope this video is important. It helps you.